Let's shift our focus now to the deepening agony of thousands of workers of organizations that have been hit hard by the stop work order by the U.S. government, an order that has also left thousands of beneficiaries of critical programs funded by the U.S. government in uncertainty. Many affected non-governmental organizations have been forced to send workers on compulsory unpaid leave, while others have opted to close shop entirely. And as Safin Achieng-Ouma reports, health stakeholders are emphasizing the need for domestic health financing to break the dependency on donor funding for critical programs.
Shock and uncertainty has gripped the health sector as the realities of the U.S. funding freeze sinks. The stop work order signed by U.S. President Donald Trump on his first day back in office temporarily suspended all U.S. foreign assistance programs for 90 days, pending reviews to determine whether they are aligned with his policy goals. A directive that has left many local government and non-governmental organizations that run programs supported by the U.S. cash-strapped and struggling to stay afloat. Kisii County government, for instance, has suspended all U.S.-funded activities and sent over 500 workers home with the January 2025 salaries only. The letter by the county director of public health and sanitation directed the workers to hand over and wait for further guidance.
Zile hospitali ambazo hawa wafanyikazi walikuwa wanafanya kazi, tumefanya mipango ya kuwatuma wafanyikazi wengine pale, ndio sababu shughuli zote za kiafya sisiweze kuharibika kwa vyovyote pile.
Homa Bay County government has also asked staff of the affected programs to hand over as they implement the order. In Kisumu County, HIV care and treatment services has been integrated with routine healthcare services in all Level 2 and Level 3 facilities. The county is phasing out standalone HIV comprehensive care centers. USAID has also announced that all workers under the Fahari ya Jamii project proceed on compulsory 3-month unpaid leave effective 1st of February 2025. The directive affects over 700 personnel operating under the program run through the University of Nairobi in Kajiado and Nairobi counties. The 4.2 billion shillings project, which was in its 4th year, was scheduled to end in May next year. Over 72,000 patients who were on ARVs have been adversely affected with the abrupt closure of over 150 clinics, which were run in collaboration with the county governments. The impact goes beyond the health sector, as Faith Ndungu, the advocacy manager at the Health NGOs Network, explains.
The magnitude from the health sector, we can say we are feeling it more because these are lives, these are people. But also other sectors, agriculture, research, even youth empowerment. Many of the fellowships which are there to strengthen and build the capacity of many different people is actually affected as we speak.
She insists that the discussion on donor transition plans is pertinent to avoid such knee-jerk disruptions.
When the abrupt decision has been made, we are talking of 1 million plus people living with HIV. We are talking of how many children. So at least the humane way to go about it is to have a conversation with the countries and tell them that in the next 5 years, in the next 3 months, we are going to be changing strategy, we are going to be transiting from your country. How prepared are you?
Considering the shrinking donor funding space, she emphasizes the need for domestic health financing to ensure sustainability.
The silver lining in a sad situation is that it's our wake-up call. It's our wake-up call to ask ourselves, when we have the LM 2019 declaration, why haven't we invested in health as was envisioned in that document by our leaders? When we fund our healthcare more, then we're in more control. If a donor for one reason or another may not honor their commitment, we will not be in a crisis.
Safin Achieng-Ouma, Citizen TV.